Male anxiety looks like nothing like what we think anxiety looks like. When men have anxiety, they often present in a very different way than what we think of as anxiety traditionally. And so a lot of the diagnostic criteria of mental disorders were more formulated towards women because traditionally and historically, women were more likely to go into therapy. And so when males suffer from anxiety, it looks like externalization. So what that means is that oftentimes when males suffer anxiety, they externalize that anxiety. So that can look like anger outbursts, that can look like irritability, yelling, aggression. It can look like physical symptoms. So it can look like stomach issues, back pain, kind of random aches and pains that seem to have no direct kind of cause. And it can also look like increased drug use, increased substance use, increased alcohol consumption. And so males often cope with anxiety in different ways as well. And so if you know someone like this in your life that exhibits these symptoms or behaviors, or maybe this is you yourself, maybe you didn't even know you had anxiety because a lot of your anxiety is kind of externalized. It's kind of put into the outside world, which is how men are typically culturally conditioned. And that's why they present more with these types of symptoms. And most of us, when we think of anxiety, we're like looking out for like those anxious symptoms, like a lot of worry and a lot of kind of rumination and things like that. But that's not the case for about half of the population. Half of the population typically will exhibit more of these types of symptoms where they're externalizing their anxiety. And that doesn't mean they don't suffer as much. It means they do suffer just as much. It's just that the symptoms are so much different.